listen. Greetings of the day, everyone. I am privileged to welcome you all into the Health Talk series organized by Student Council of Sadabai Raisoni Women's College, supported by SGR Knowledge Foundation and powered by Raisoni Group of Institutions. In today's session, we'll be discussing about the impacts of sugar level. What can happen when your sugar level becomes dangerously low or high? To give information about this, here we have with us Dr. Umesh Hassani sir. I welcome you, sir. Umesh sir has completed his MBBS from NKT Salve Institute of Medical Science. He is a microbiologist in Seva Diagnostic Lab in Nagpur since 15 years. He developed interest in sharing his knowledge and got experience of 15 years in teaching. He has published 11 research papers nationally and internationally. He is Associate Professor in Microbiology Department of NKT Salve Institute of Medical Science. He not only got second prize for poster presentation state chapter conference, but also for oral paper in NIMACON. He is certified auditor of National Accreditation Board of Testing and Calibration Laboratories and Basic Life Support Training. I, Tejal Singh, welcome you in our Health Talk series on behalf of all. Now, without taking further of your time, I hand over this session to you, sir.
Thank you, Tejal, for nice introduction. Uh,
Yes.
so basically, the topic for today is impact of the glucose level. So it can be a high glucose or a low glucose. High glucose is called as hyperglycemia, which I will be taking in my session. That is diabetes. Okay. So in
Yes.
diabetes, we are going to have I'm just starting to share my screen and then I will start the today's session. Okay. Is my screen visible, Tejal?
Yes, sir.
Hello. Okay. So the main problem is today we are facing an pandemic of diabetes. So all of you now have heard about pandemic of COVID. There is a pandemic of influenza going on. So this is again a pandemic which is diabetes. So what is pandemic is any disease which is spread all over the world and is increasing is diabetes, is known as pandemic, and one of the diseases is diabetes. So we have used this term pandemic only with the infectious diseases. Now this diabetes is a non-infectious disease which is also a pandemic. Another pandemic which is going on is hypertension. So I will be taking diabetes today. Now, by definition, diabetes is a metabolic disease in which the body's inability to produce any or enough insulin. So there is a term which is known as any, matlab there is no insulin production or the insulin production is deficient so that it causes the elevated level of glucose in the blood. So what happens in normally glucose is an important source of energy for the cells that makes up the muscles and the tissues. It's also the brain's main source of the fuel. So whatever you eat automatically converted to glucose in your body. So when you eat, there is increase in the glucose, that is hyperglycemia. The amount of glucose in the blood increases and it triggers the release of the hormone insulin. Now this insulin hormone is produced by beta cells of the pancreas. There are two types of cells in the pancreas, alpha cells and beta cells. These beta cells are responsible for production of insulin. It's an endocrine secretion, it's an hormone. So insulin, when secreted, it stimulates the muscle and fat cells to remove the glucose from the blood and stimulates the liver to metabolize the glucose, causing the blood sugar level to decrease to normal levels. So whenever glucose is increased, this insulin will help the glucose to go inside the cell. So without the help of insulin, excuse me, the glucose will not enter the cells. Now, what are the various types of diabetes? So there are four types of diabetes. One is type 1, another is type 2, third is gestational diabetes, and fourth is pre-diabetes. So we will know about each type of diabetes in the subsequent slides. Now, first going to the epidemiology. Before going to epidemiology, why this topic is important is because at least one out of three individuals who are born after 2000 may develop diabetes in their lifetime. So it is so important for all the people who are born after 2000 is important that they should know about diabetes. So going by the worldwide epidemiology, you can see that in 2001, the diabetic population above 35 years was 359.8 million, and uh, population above 35 years out of 359 millions, 32 millions were diabetic. In 2013, approximately out of 424 million population, 65 million people are diabetic. Now, when we are approaching 2022, that is 2020, it is a 466 million population, and the expected diabetic population is more than 100 million. And in 2030, when the population of people above 35 years will be approximately 560 million, you will have more than 123 million diabetes. So this is very important. So it was predicted by the scientists in 1990 that the number of diabetics will reach 100 million worldwide by 2013. So now it is, now the actual number in 2013 was 382 million. So it has passed this 100 million three times in 2013 only. So in 65.1 million Indians are diabetic and about 78 million people are in the pre-diabetic stage. And the number predicted for 2030, as I have shown in the previous slide, is 123 million people will be diabetic. Now, as I have told you in the previous slide, that when we classify the diabetes is classified in type 2 gestational diabetes and pre-diabetes. So what is type 1 diabetes? Type 1 is also known as juvenile diabetes because it occurs in children less than 10 years of age. It is usually diagnosed in children and young adults. So it happens when the body's own immune system destroy the insulin producing cells of the pancreas, which are also known as beta cells, which produce insulin. So your own body's defense mechanism destroys the beta cells. It is an autoimmune phenomena. There are various reasons. One of the reason may be a viral infection. There are other reasons for this destruction of beta cells or autoimmune disease. So this out of the total diabetic population, only 5% are type 1 diabetes. That is, they have got diabetes since uh, they are of 10 years or 11 years of age. So in this people, body does not produce insulin because beta cells, the factories of producing beta cells is destroyed. So the body does not produce insulin. So it is not preventable disease. And there are various causes like predisposition to diabetes. There are some genetic factors, something like viruses, weather in the environment which triggers the disease. So you cannot do much to prevent occurring this, but you can control this. That we will see later on. How can we control this? Now, what are the symptoms of diabetes? This slide I could have taken later, but this is very important to know what are the symptoms. So the common symptoms of diabetes are excessive thirst and appetite, increased urination, unusual weight loss or gain, fatigue, nausea, vomiting, blurred vision sometimes. In women, there will be frequent vaginal infections. In men and women, there can be yeast infections, mouth, slow healing sores or cuts, itching skin, especially in groin or vaginal areas. And if we are talking about type 1 diabetes, they usually present with hypoglycemic symptoms where they don't eat, they may cause, or hyperglycemic symptoms. So they may directly present in coma. So, on sudden unconsciousness, you have to think whether there is decrease in the glucose level or increased glucose levels, which is causing this unconsciousness. So you can see the picture over here. This is always tired. There is a frequent urination, sudden weight loss. There are difficulty in healing of the wound, polyphagia, polyuria, and polydipsia. These are the three cardinal signs of diabetes. Polyuria, increased urination; polydipsia, increased uh, thirst; and polyphagia is increased hunger. There, other than that, there can be a sexual problems, there can be blurry vision, there can be tongue tingling or numbness in the feet. Now coming to the next type of diabetes, which is known as type 2 diabetes. It's the most common form of diabetes. About 90 to 95% cases of diabetes are type 2 diabetes. It is also known as adult onset or non-insulin dependent diabetes. Here the body produces insulin but does not use it properly. So that glucose doesn't move into the cells, they pile up in the bloodstream, again increasing the glucose level in the blood. So here symptoms occur, but they do not see, they are not serious. So people usually they ignore them. You can see this type 2 diabetes. You can see that this is not fitting in any of the thing. This jigsaw puzzle is not fitting. So this insulin is not fitting in any of the cellular thing. Therefore, there is insulin is not produced, proper insulin is not produced, hence type 2 diabetes happens. So what are the risk factors of this? One of them is genetics. So suppose maternal or the paternal persons like mother, father, uncle, aunt, mama, mami, nana, nani have the history of diabetes, then you are more prone for getting this disease. Another is a disease which is very common nowadays in the obese uh, women, that is polycystic ovary syndrome. The person who are suffering from polycystic ovary syndrome, they may have this particular disease. Africans, Americans, Hispanics, and Asians are more prone for diabetes than the white population. So it is more in the China and Indian subcontinent, the diabetes is more common than the Western population. Uh, Usually it occurs after age 45, but now we are seeing up to the age of 30, the people are having diabetes. So it is increasing. And why it is increasing? In the subsequent slide, I will tell you why it is increasing. So one of the factors are the environmental factors. So now there is increase in the inactivity. Most of our work is done by on the either mobiles or on the laptops or sitting at home. So there is inactivity, there is a weight gain, and the lifestyle is becoming sedentary. So you don't have any exercise in your life, and there are improper eating habits. So I have just prepared some pictures which will show you how environmental factors, and these environmental factors can be controlled so that the risk is decreased. So all these are very yummy, very tasty, but yes, these are the high carbohydrate, high fat containing food which may cause diabetes and hypertension. Another picture, again, lot of sweet, cold drinks, ice creams, donuts, gulab jamun, jalebi, all these things may lead to carbohydrate consumption and you may become obese and prone for. Then these are the sedentary. There is increased risk in the smokers, in the alcoholics. You can see the obese person always sitting OTT platforms, all this. You can see the person sitting in the office eating and drafting the mails. The last picture is very old. Nowadays, you don't require this computer. You have handheld device which is known as mobile. When you sit in the loo, you are always with the mobile. Now coming to the third type of diabetes, which is known as gestational diabetes. So having diabetes during pregnancy is known as gestational diabetes. Why it occurs? It occurs in the persons where there is a family history of diabetes, or the female is overweight prior to pregnancy. Now, once you have a gestational diabetes, it puts you at a risk for diabetes type 2. So after delivery, the sugar may come down, but after some years, you are at increased risk of diabetes type 2. So where it is, what happens here? There is increased chances of macrosomia. Macrosomia means the baby is of larger size. So any baby more than 9 pounds increases your risk for type 2 diabetes. Now 18 out of every 100 pregnant females develop the gestational diabetes. So whenever there is high glucose level in the bloodstream of mother, it will go into the bloodstream of the baby, and the baby will develop increased weight or weight gain, and baby will become prone for diabetes in future, and mother will also be prone for developing diabetes in the future. These are the various complications of the diabetes. Now, what is pre-diabetes? The fourth one was pre-diabetes, when your fasting and post-meal blood sugar levels are between 100 to 125 fasting and between 141 to 200 post-meal. This is known as pre-diabetes. Normal blood sugar level are 70 to 100 and post-meal blood sugar level are 70 to 140. And more than 125 fasting and more than 200 post meal is taken as diabetes. Now there are various devices. One of the devices which is a well engineered device is a glucometer, which helps in maintaining the glucose level in the blood in the diabetes. So you have to have this glucometer with you, and you should put, and not only monitoring in this, you have to make a track of blood glucose level in a logbook which you have to maintain. So you have to write date, time and blood sugar level, fasting, post meal in the logbook. That's how you monitor your diabetes. Now, any disease can be prevented by three means. There is a primary prevention, secondary prevention, and tertiary prevention. Another prevention is also known as primordial prevention. So, what is primary prevention? So, primary prevention is the disease health promotion and specific protection so that disease does not occur. Secondary prevention is early diagnosis and the prompt treatment. Tertiary prevention is disability prevention and rehabilitation. So first is you should not have the disease. So diabetes cannot be primarily prevented, but secondary prevention can be done. There can be an early diagnosis and a prompt treatment. Tertiary prevention can be done. So once they have got diabetes, so you should have disability prevention, like should not avoid complications and rehabilitation. Primordial prevention is like in a gestational diabetes, if you maintain blood sugar level properly, the chances of having diabetes to the baby is becoming less. So this is known as primordial prevention. You are changing the environment so that the disease does not occur. Now, type 1 diabetes is, as I have told you, is not preventable as of right of now, because we don't have anything which can regenerate these beta cells or which can prevent these beta cells from being destroyed. So what you can do is maintain and control sugar levels and take proper insulin injections, uh, take healthy lifestyle, take proper exercise and diet. There is one study going on islet transplantation, and also I will make I will like to share you that this is being done for beta cell loss. So there are various biomarkers for diseases. So there is one Dr. Hasner which is investigating these biomarkers so that he can predict which individuals are most likely to develop type 1 diabetes. Because once you have that biomarker, you can prevent the clinical symptoms to occur up to, suppose the diabetes is occurring at the age of 10 years, you can postpone it to the age of 20 or 25 years. So this will be very helpful. Why I am telling you this is because biomarkers are one of the good uh, thing which can be done with the students of engineering and medical. These are the bioengineering concepts. Type 2 prevention is primary maintain a healthy lifestyle. This is a primary prevention. So if you have got your mother, father who are diabetic, you maintain a healthy lifestyle so that you may not get that diabetes or you may get it at the later age. Second, check your HbA1c. This is Hg nahi hai. It is HbA1c and adjust your diet. What is this HbA1c? HbA1c is a hemoglobin which is associated with your glucose levels. So you have to test it over span of 3 months or 90 days. So normal HbA1c is up to 5.6%. Pre-diabetic is 5.7 to 6.4 and diabetes is 6.5%. Do exercise. Tertiary prevention is exercise and eat well and always go for foot examination. So you can prevent or delay type 2 diabetes or you can manage diabetes. Gestational diabetes, how can you prevent is physical activity. Researchers have found that being physically active before and after their pregnancy reduce their risk of gestational diabetes by about 70% or more. And by having proper diet. A study showed that each 10-gram increase in fiber a day reduced their risk of gestational diabetes by 26%. So all pregnant mothers should have diet rich in fiber and should do more physical activity. What is the future? Now, for type 1 and type 2 diabetes, we have this complete or partial beta cell loss. So, how can we regenerate this beta cell is by putting human beta cells from stem cells. There are some stem cells which can generate into whichever cells which we can have and program that as beta cells, or we can use a non-human beta cells like pig or non-human primate cells or from the donor beta cells. So this can be done in future. There is another study which says that brown fat transplant may aid in weight loss. So there are two types of fat. One is white and another is brown. So brown is derived from muscles and it is highly thermogenic and it burns energy to produce heat and maintain body temperature in warm-blooded organism. So this increased good fat, this is a good fat and this may lead to increase the weight loss and diabetes management can be done with this. Oh, so, coming to the few last slides, so what can be done is parent, teachers, and healthcare providers have very important role in imparting health education They should conduct, we should conduct health awareness and education program like we are conducting right now. Canteens in the teaching institute must serve healthy snacks and fruits in place of junk food like vada pav, pizza, burger, samosa, aerated drinks, etc., which you will all not like. Compulsory physical exercise period at least 3 times in a week. Now, in a even in a professional course, it is advised that the young children who are studying there should have a physical exercise period. There should be psychological counseling session at schools to help children to tackle the stressor in their life. There should be lifestyle modification in which you should have weight control, regular physical exercise, proper diet rich in protein, abstain from smoking and alcohol consumption, maintain positive attitude towards life and manage stress, regular health checkup for hypertension and diabetes mellitus group. So this is how you reduce this: swimming, cycling, dancing, brisk walking. 30 minutes of exercise a day can reduce your risk of developing type 2 diabetes by 40%. So this is again a diabetes food pyramid, exercising. So my prescription for preventing type 2 diabetes is eat healthy, exercise, and lose weight. These are certain websites which you can visit, and you can know more about diabetes. So are these familiar thoughts? Then you could be at risk. Thank you so much. Any questions?
Thank you for your excellent informative session, sir. Now I
Okay.
would like to ask you a few questions.
Okay. You can ask.
What is the hardest part of being diabetic?
The hardest part of being diabetic is accepting
Diabetic.
and maintaining discipline for diabetes. As I have told you in my presentation that first of all, the symptoms for type 2 diabetes are very less. So it's not serious. Like if you have got fever, you will visit doctor. But if you are having increased food intake or increased polyuria, going to increase for increased frequency of urination, very few people go for that particular thing to the doctor. So first you have to see, you should know about the family history, whether your father, mother, any other uncle, auntie is diabetic. So you should take care that you should not get diabetes. Discipline is very important. Eating healthy is becoming so difficult today because you have got so many temptations. Like there are so many things which are available to you without doing anything. So, and they are all carbohydrate dense food, which increases your blood sugar level. So, all these things are very difficult to control. So, you have to control your first, you have to control your diet. You have to take a proper exercise, eat proper food. Then you have to have a maintaining a lifestyle is difficult because the timings are not conducive. You are not sitting at home. Sometimes you are working late in the night and you are gorging on whatever is available to you. So all this thing will increase. So this is very difficult for diabetics to manage, how to manage all these things. So these things are, according to me, difficult for difficulties in the diabetes. Another thing is if the person is type 1 diabetes or if he is taking insulin again has got some society stigma also. He is taking insulin and all these things. But I will say that taking insulin is not harmful. It's a natural hormone which you are not producing, therefore you are taking from outside. So this is what is difficult in diabetes.
What are the long-term complications of diabetes and how can we avoid them?
Yeah, it's a very important question, a very nice question, a very long-term complication. Uh, you will, why should you worry about diabetes? You don't have any symptoms. Long-term complication of diabetes are because it's a microvascular disease. your vessels are clogged. Your vessels, the vessels which are thinner than your hairs, are supplying blood to your heart, your kidney, your brain, your eyes. Suppose this part of your bodies don't get the blood supply because the arteries get blocked. So what will happen? You will have difficulty in vision. So you will not be able to see properly, which is known as diabetic retinopathy. You have increased chances of having brain stroke or heart stroke, that is myocardial infarction, or you may have paralysis. So these are increased. Then the vessels which are supplying to kidney may be damaged and you may suffer from chronic renal failure, that is loss of kidney function. Then sometimes these vessels, they of the feet and fingers, they get blocked and the vessels do not get blood supply. Sometimes they may lead amputation of the limb. So you may lose a hand or a feet. And more so when diabetes is uncontrolled, the person will be having problems in healing. So any disease which is there, any scar, any wound will not heal properly or will take much time to heal. So these are the long-term complications of diabetes, and I hope that with today's lecture, the people will be aware and they will make others also aware that you have to control diabetes because it is not disease of today. Today, if you control, you will have a better tomorrow. So for a better tomorrow, you have to start today.
Diabetic patients, those who have taken medications or insulin, will they always need to take those medications or insulin? And how will you evaluate whether these medications or insulin are the best treatment for them?
If the blood sugar is controlled with any medicines, then it is a good medicine. Our main motto of giving the medicine is to control the blood sugar, right? So first,
Yes.
and second is whether the person will require lifelong insulin. Yes, if he is type 1 diabetes, he will require lifelong insulin. If he is type 2 diabetes and his insulin production is less, then he will require insulin maybe in the variable amount. Those may be decreased or increased. But tablets, yes, once labeled diabetes, most of them will require diabetes tablet. They should the tablet and start something which is like some churan or some kada or something like that, and they will cause increased sugar level and they will land up in the hospital. So if you want to decrease or if you want to stop your diabetic medication, you have to follow the proper lifestyle which I have told you in my presentation, that is exercise 40 minutes daily, eat proper food, and then examine your blood glucose level weekly or monthly, so that if you cannot examine, you can go for HbA1c examination every 3 months, and then your doctor can increase or decrease your or stop your medication depending on your discipline level. If you are following the proper discipline, he may stop. Another thing is today alcoholism and smoking is very common, and again these are the factors which increases the sugar level.
Thank you, sir. It was just awesome being a part of this session. We are grateful for your time and effort you took to share your thoughts. I once again thank you, sir, and all the audience in from off the systems. Thank you all.
1 minute, Tejal. I just want to have one screenshot. Uh,
Yes, sir.
okay. Okay, I have taken. Thank you.
Thank you, sir.